Hi, I'm Lauren Forsythe, and I am a clinical assistant professor at the University of Illinois College of Veterinary Medicine and the Pharmacy Service Ed.
Hi, I'm Dr. Joni Fowler, and I'm a clinical pharmacist, and I'm here on behalf of freeCE today and as a continuing education pharmacist. And I'm involved in animal rescue. And Lauren and I are both members of the American College of Veterinary Pharmacist. I know she's also involved with the Society of Veterinary Hospital Pharmacists, maybe some other organizations as well.
Yes, and through that, we are really passionate about educating pharmacists in the veterinary medication side of things for their pet patients because we don't get a lot of that in school. And so through freeCE, we've had the opportunity to come up with this great continuing education course certificate type program where we are providing a lot of that information that maybe wasn't covered in school.
Yeah, most of us really didn't get any of this in school. And I know I've had to learn it really post graduation in practice. Tell us a little bit about this continuum from the pharmacist in the community that does what we would call an occasional fill for a pet patient, all the way to sort of a career path in veterinary pharmacy. What are the different ways that you can become involved in this area?
Well, like you said, the community pharmacists are almost always going to see at least the occasional veterinary prescription. We use a lot of human medications in animal patients. And so those pharmacists are required to have a knowledge base they can pull from, regardless of how frequently they see those prescriptions. And there's a little bit of CE opportunity out there, but not a whole lot yet. So we're trying to fill in that space through freeCE. And maybe you were lucky and you were in one of the few pharmacy schools that does have an elective class and you got to take that, or you got to do an elective clinical rotation in a vet hospital and learn some more content there. But otherwise, if you're in the community setting, looking at some of the CE opportunities is going to be your best bet to get into it. There's a little bit more into the compounding side. You can end up in veterinary specific compounding pharmacy. We use a lot of compounded medications in animals, so it's a great opportunity to do that. You might see veterinary compounds in a pharmacy that also compounds for humans, or you may have the opportunity to be in a specific pharmacy that specializes in veterinary compounding. And there's some continuing education courses. There's some hands-on compounding activities to start to learn that. I'd say it's the same baseline knowledge as what your community pharmacist would have, but then you also need to have the knowledge of the veterinary specific formulations, the toxicities, the high quality formulation considerations, and that advanced compounding knowledge to build off of that. And then there's a very small specialty of veterinary pharmacy for those of us who really want to live in the animal world. And we end up usually in teaching hospitals, teaching veterinary students about how they should write prescriptions, how they should consider medication options for their animal patients. And we oftentimes get to this point by doing a residency in veterinary pharmacy.
And so you actually practice in a veterinary school, correct?
Yes, yes. My sole practice site is a veterinary school.
Yeah, so you're that other extreme of the continuum that's really immersed in it and really day to day with the animals. But when I approached you about doing this Essentials of Veterinary Pharmacy certificate program, I was looking for people like me and my colleagues that deal with animals, what I would call on a regular basis, but we really don't know much about it because we didn't learn in school. So when I sort of pitched this idea of let's do this Essentials certificate, tell me what you were thinking because you came up with this incredible content for this project for any community pharmacist that might be interested.
I have jumped into the concept of these community pharmacists we need to help. I hear about it from the vet side. And so I'm working with those vets that are like, I'm trying to prescribe this and the pharmacist doesn't understand this, or I need help. And so when from that perspective, I saw the need. And so I was really excited about the opportunity because I don't have a lot of pharmacist facing opportunity. I face the vet side a lot. And so the opportunity to help work with the pharmacist and share some of that information, since I know that it's really not covered in school. So we don't get it. We're just sort of thrown into it. And being able to say, okay, what do we need to know? And how can we link it back to humans? Where can we make those connections? And where is it different? And we need to contrast the two.
Yeah, we know at freeCE we've had a lot of requests for this topic, and interesting timing. Just a few weeks ago at APHA, there was a whole mention of this veterinary pharmacy in the House of Delegates. Can you tell us a little bit about that?
Yeah, that's a really exciting initiative from American College of Veterinary Pharmacists, or ACVP. And they are a group of pharmacists, primarily more community setting pharmacists with an emphasis on veterinary prescriptions. And they've seen the need. They said, hey, we're out here and we don't have this. And we really need to be getting our future pharmacists out there with this knowledge. And previously, APHA had amended their definition of a patient to include animals in that and really emphasize the fact that pharmacists are the one profession that gets to treat all species, whereas everybody else is either humans or veterinary patients, but we're both. And so they followed that up with the House of Delegates passing the encouragement of pharmacy schools including this in their curriculum and providing CE opportunities for the pharmacists already out in practice. So we can be better placed to have effective roles in this opportunity.
So who is the target audience for this? In addition to pharmacists, you've mentioned community pharmacists. What about pharmacy technicians?
Yeah, this would be great for pharmacy technicians. Pharmacy technicians are so critical in the workflow in all different types of pharmacy. And they're often, I mean, a good pharmacy technician or a bad one can make or break a pharmacist. And so really we wanted to gear this towards the whole pharmacy team. And we included these perfect tech tips into our courses for things for technicians to focus on. But really the content is great for both pharmacists and pharmacy technicians.
Now, does it matter where the pharmacists practice? Do they need to be like in a chain or an independent or in a city or in the country? Or tell us who the target is for those.
Really, any pharmacist in the community setting is highly targeted because I would be hard pressed to find any community pharmacy that never fills a prescription for an animal patient anymore. And therefore, you really should get the education. And I think it's a great opportunity. We start with the basics and the foundation and build up throughout this first part of the certificate program and really give that foundation that you need that's designed to be applicable in any rural area, any metropolitan area. You may see some differences in the volume of prescriptions or the exact medications being prescribed depending where you're located, but this is a really overarching general concepts course, so it's going to be applicable nationwide.
And how many hours of accreditation, ACP accreditation, does this course contain?
Well, if you do the full certificate, you can get 6 hours of continuing education. And we're just really scratching the surface here. So we've got a lot more to offer coming up. And if you don't want to do the full 6 hours off the bat, you can do it in smaller 2-hour chunks. And it's broken into 3 different 2-hour chunks of information. So it's really broken down into a way that's easy to digest and absorb and take a lot away from.
Do you need any specialty training to do this essential certificate, the Essentials of Veterinary Pharmacy?
You don't need any specialty training. You want to be a pharmacist or a pharmacy technician and have some knowledge of how a pharmacy works. But that's about the baseline that we assume. We assumed you've done your licensure status certification and are comfortable with your role in human pharmacy and therefore are ready to connect that to the veterinary side. And we teach that the basics you need to know, the regulations, we teach the toxicities, the counseling points. We hit on all those, the species differences.
Yeah. And I noticed this is really targeted to companion animals. Do you want to kind of clarify for us the difference in the companion animals that we're going to cover in the essentials versus livestock animals or food producing animals and why that is sort of a separate category, and then also performance animals?
So we focus a lot on dogs and cats. We find that that's going to be the highest species prevalence in the community setting. And so therefore we wanted to cover those with a lot of emphasis. We also do cover some equine information. You might get the occasional equine script depending on where you're located, probably more likely to see that in a rural area versus in the middle of New York City. But it's possible to see that anywhere. And with equines, we do have the performance horse consideration. So we talk about drug testing, and they're really athletes. So they can be very high level athletes, just like high level college or Olympic level human athletes. And we have to consider that. We don't go into the livestock food animal side of things because that adds a whole extra regulatory layer on when you can use drugs because of the concern about making sure that all of our meat and other edible products are completely drug-free. So we're not ingesting any sort of drug residue. And so for the most part, we stick to using veterinary labeled medications in those species, and those are going to come more directly from the veterinarian. So it's less likely to see in the community setting. It doesn't mean you never could see them, but we only have so many hours, and so we wanted to focus where the majority of pharmacists are going to see prescriptions.
And have you seen the same stat that I have, that almost like 3/4 of pharmacists will fill an animal prescription in practice?
Yes, definitely. And that's very much aligned with, if you're in community pharmacy, you're going to see an animal script at some point.
Yeah. Sometimes they come in and get a blood pressure med, and they also have a blood pressure medicine for their dog, right?
Yep. And it might be the same one.
Yeah, it might. Or it might be something that's very toxic to the dog, as we've
Yep.
learned. Yeah, yeah. So give me an example of that. So let's think of an example of something we sort of learned that everybody should know, as far as things that are going to be in this essentials certificate that you need to know, like get an example of maybe a formulation for dogs or a formulation for cats that the pharmacist really must know.
For cats, the big thing is Tylenol is toxic to cats, any dose. Even if your cat is the size of a small child, and you can dose that small child safely with Tylenol, you cannot dose your cat safely with Tylenol. Cats just don't have the ability to metabolize it the same way people do. So we get a toxic buildup, and they can die and decompensate very quickly from that. With dogs, one of the biggest things we worry about is xylitol. And you may not be super familiar with it. We don't talk about it a lot on the human side because it doesn't really get absorbed in people, and it's safe. We use it as a sweetening agent. In a lot of human medications, it's in toothpaste, it's in mouthwash, it's in sugar-free gum. So it's very prevalent, but it's toxic to dogs. And therefore, we have to be cautious with medications. Gabapentin liquid is the biggest culprit that we think of when we think xylitol in medications, and concern for use in dogs. There are other medications, though, that we'll talk about, different dosage forms that are suspect to having xylitol. And it's hard to find. It's kind of like a scavenger hunt to try to find xylitol, or whether it does or doesn't exist in a medication.
Yeah. Yeah, you really dig into the toxicology aspects and the essentials of veterinary pharmacy. And, to the point of xylitol, there are so many things we ingest on a daily basis, or that pharmacists dispense, that are not problematic at all for humans. And sometimes we think of pets as children at milligrams per kilogram. I can just calculate it based on weight and we're all good to go. And that's clearly, you're very good at clearing that point up in essentials of veterinary pharmacy, that can be a real toxicology problem.
Yeah, there's a lot of toxicology problems that pharmacists should be aware of, because even veterinarians can't really determine what has xylitol in it either. So they rely a lot on the pharmacist to be able to say, hey, this is for a dog. Okay, we need to make sure there's no xylitol. And a lot of times it does fall to the pharmacist to figure out.
What are some other common questions you have heard from the veterinarians about, things they wish the pharmacist knew?
They really wish the pharmacist knew to send the pet owners back to them when they want over-the-counter medications. With pharmacy, when I've worked in community pharmacy, one of the fun parts is getting to go help clients find, or patients find, their medications that they can get over the counter to treat their headaches or their muscle aches, and help them find those. But unfortunately, we can't do that for animals, because when any medications that are labeled for people are what we call extra label in animals. So that means that we're using them in a way that's different than the label, and therefore it needs to be pursuant to a prescription. So we unfortunately cannot go recommending over-the-counter meds. And if a client comes and they say, hey, my dog is really painful, I'm going to take him to the vet tomorrow, but can I give him something tonight? We can't recommend anything. We really need to recommend they call the vet and say, what can I do until I can get in tomorrow to be seen? So there's that one. And the call the vet, call is one of the big ones. We do a lot of weird stuff in veterinary medicine. Sometimes we use desmopressin nasal spray as eye drops in animals. And it does work that way. And so sometimes there's weird things. So don't assume that it's going to be the obvious, oh, I think they meant this. Just call and ask. That's one of the biggest things that vets say. I actually have a video in one of the modules where I interview some vets and I ask them what they wish pharmacists know. And that, and references, having a reference on hand to look things up for veterinary specific patients is important too. So we talk about a lot of references and go into details on which ones work well.
Yeah, a lot of references. We're going to make lots of recommendations about their apps and books and things. And many of these are actually free or not very expensive. And they're things that could easily be put on your computer system or on your phone, or you could get a book, an inexpensive textbook or something to keep on the shelf. as a
Yeah.
resource for toxicology. So let's talk a little bit about COVID and pets. So, one of the things in animal rescue that we've learned is there were a huge amount of adoptions in 2020 and even in 2021. But unfortunately, the number of veterinarians that came into practice, didn't really keep up. So we rescued a lot of cat and dogs, and we're pushing them back out there for all these stay-at-home people. Tell me about what that dynamic has been like compared to pre-COVID, and the dynamic and the need for veterinarians, and maybe where the pharmacist can help bridge this gap a little bit.
Yeah, there's a lot of things that come into play with that. COVID spiked our pet adoption rates a lot. So we have much higher pet ownership rates from COVID forward than we used to, combined with the fact that people were staying at home. They're at home. Now they can see that their dog is coughing all day or itching all day. And now they need, like, oh, that's a problem. Whereas if they were working, they may not have noticed that. And so we see people bringing their animals into the vet potentially earlier, which is great, but it also does increase the demand for pet care. And vet schools, to put it in perspective, in pharmacy, we have, I think, 130 some pharmacy schools currently in the United States, whereas we have, I think, about 40 vet schools. So we have very small numbers of vet schools compared to pharmacy schools, and vet schools take a long time to establish. They're expensive, and building that and meeting the accreditation requirements takes a long time. So it's not something we can turn around overnight. There are new schools opening, but again, they're just starting to open. They're just starting to build their faculty. So then we have to get classes all the way through. And so it's a 4-year program. So we have a gap, and it's not a quick fix. I think it'll correct itself eventually, but we need something that's going to treat the pets we have now and not burn out our veterinary staff in the process. So by educating pharmacists and being able to get pharmacists to the level where they can confidently help with some of these things. Oh, I don't have to dig through 15 formulations to figure out which one has xylitol. My pharmacist can figure that out for me. Things like that. And being able to count on pharmacists to help with that will be really important.
You do a great job in Essentials of Veterinary Pharmacy of really putting lots of touch points in there where the pharmacist has an opportunity to take advantage of this gap in care. And some of those we mentioned were toxicology, some are compounding, some are dosing calculations. Another big thing that you're a big believer of is counseling. So tell us about this sort of disparity and the paradox between the pharmacist and the veterinarian related to counseling.
So there was a study done in Ohio a few years ago where they polled Ohio Pharmacists Association members and Veterinary Association members, and they asked both groups, what is the primary role of the pharmacist when filling veterinary prescriptions? The pharmacists, the majority of them said the primary role is counseling. We do that. I mean, that's mandated. We have to do that in every state. And that's a huge part of our role in community pharmacy. Whereas the veterinarians largely said that the pharmacist role is compounding. Veterinarians can do their own compounding. They get next to no education on doing it. So they often rely on pharmacists to do it for them. And so to them, that's the specialty. That's where they need to be focused. But really, pharmacists don't get that much compounding education either unless you pursue it. So we end up with this parity where the pharmacists are saying, oh, yeah, I counsel. That's my expertise area. Well, vets aren't really well trained on counseling either. But the vets have the knowledge base. The pharmacists have the skills. And so we have that mismatch. And unless we can teach the vets the techniques on counseling, or we teach the pharmacists the knowledge on the vet drugs, we're going to keep having this gap. So I'm trying to do some of both, and teaching both vet students how to counsel on medications and teaching pharmacists how to counsel on vet prescriptions.
Yeah. And it really reduces errors as well. Not only does it make you more valuable to the pet parent or the client, as you call pet parents, but it also reduces errors because you catch things in the process where there's some misunderstanding or gaps, and you can often correct them in the moment, just like you do with human prescriptions.
Exactly.
Yeah. So talk a little bit about pet insurance. We don't get really deep into that, but we do mention that in Essentials of Veterinary Pharmacy. That's kind of a cool area. Pharmacists deal with insurance all day long, and they don't love it by and large. How is pet insurance different, and why is it important?
I say that's one of the best parts of my job is the fact that I don't have to deal with insurance because we don't generally process it like we do human insurance. There is pet insurance. It's increasing in prevalence, but it's by no means where human health insurance is. And pet insurance is often more of the major medical type concept where you have the insurance, you know what it covers, take your animal to the vet, submit the bill after the fact. And so you usually pay and then you get reimbursed. And so you might get reimbursed for your pet's medications, but you're getting it by submitting the receipt from those medications. And they're verifying then that it's not a pre-existing condition and they'll cover it. Unlike human pharmacy, where we're often running the insurance and processing it through. There is a little bit of a trend, I think, that I've heard in some pharmacies where some insurance companies are starting to set up their vet insurance so that it can run through the pharmacy software, but that's still the exception, not the norm at this point.
Mm-hmm. And I was thinking about kind of the lifespan of the animals, and you know that as they become seniors, or there's certain other things that cats may have in their anatomical characteristics or whatever that put them at risk for chronic diseases. If the pharmacist knows this, they may be able to help the pet parent anticipate that they may need chronic medications at some point, expensive medications. And we actually have an oral drug for cats now for diabetes. And so, you know, who would not want to give a cat a pill versus an injection if they could? But it would be really great if you had the insurance to cover that before that happened.
Yeah. The with the pets being largely cash pay, where they're client funded medications, it does decrease the cost of veterinary approved drugs to start, but it also limits our ability to use some of the newer human drugs because we have to wait for them to become generic. A lot of them are cost prohibitive before they become generic on the human side. And so that's why we're several years behind humans on using the newer drugs in most cases. But it's also really cool when we do have insurance and we can start to use it. A lot of times insurance covers 70 or 80% of the cost up to whatever the maximum for the year is. But being able to anticipate that, because we're keeping animals alive longer, but they can get these chronic conditions that really add up on cost. I have a Maine Coon cat, and my Maine Coon is susceptible to cardiac disease. She doesn't have it, but by her breed, she very well could get it. And there's dog breeds that are also known to be likely to get cardiac disease. We have a lot of data on how to treat cardiac disease in animals and the medications we can use to do it, but those really add up over time. Some of those effective medications can be really pricey. So it's important that owners are prepared for that. And by having that insurance before it becomes a pre-existing condition, they can oftentimes make it much easier to fund and say yes to the long-term therapy that'll extend the life of their animal.
I saw that the American Veterinary Medical Association had put out some trends and data every year about pets and people. And one of the things that they said in this last year's issue was that up to 96% of pet owners consider their pet part of their family. So is that part of your motivation for this? I mean, you know, obviously now it's not just for the people in the veterinary hospitals, it's everybody.
Yeah, the pet owners largely think of pets as children. My generation, there's people that have their pet babies and they have no intentions of having human babies. And so we have this new generation of pet parents, and it's important that we're prepared for that. And I've had clients or pet parents tell me, yeah, if I have to pick, I'm going to pick my pet's medications over mine that I have to pay for. And so we don't want them to get to that point. And there's things we can do as pharmacists to help prevent that.
Yeah, pharmacists are great. They're truly the drug experts. Now, tell me a little bit about the Essentials of Veterinary Pharmacy, the certificate program itself. I know that it's in some really cool, innovative platform. I know a lot of the things that we've seen out there have been pretty dry. It's, you know, a lot of just pharmacology and law, and you have to get the law in there. But tell me how you've made that fun.
I was super excited by this platform. When I agreed to do this, I was thinking it was going to be, I talk on PowerPoint with PowerPoint and on video for an hour and lecture. And was so excited when that did not end up being what I needed to do, because I think that's boring to do. I'm sure it's boring for people to listen to. So we have this fun interactive platform where it's very limited reading as far as the content on the platform and limited amounts of time you have to listen to me talk. But you get to do things, sorting activities, ranking activities, matching, simple, low stress, low importance activities that really solidify these things. They give you chances to interact with the content, not just sit there and blindly absorb it. So it really can help drive home some of these key concepts because you get to use them. And that's really what's going to teach it, is applying it to scenarios, and the fun avatars with the different scenarios really liven it up. I was so excited when we were building this, and I got to go show my husband, hey, look at this cool CE platform. And he knows nothing about healthcare, but he thought this was great to scroll through and be like, oh yeah, that's way more interesting than what you usually do.
Everyone that we've had sort of peer review it has said the same thing. They're like, this doesn't look like normal CE. It's very cool and engaging. And I forgot that I was spending an hour getting
Yeah.
this done. Yeah. And we've got some downloadable resources in there. We're going to continue to kind of go back and add some new resources to it so that people can pull things off, and save them. We have lots and lots of links to, veterinary organizations, to the veterinary manual, resources that the legal issues with the FDA, things the pharmacist likes to be able to go to read more about it. And they can really, AKC and the cat links and the horse links, you really can take a deep dive if you really don't know anything about animals and get up to speed about the different species and some of the unique characteristics.
Yeah, it really gives the pharmacist or the technician that's doing it the opportunity to learn and pursue the things that they don't know as well, and test themselves like, oh, okay, yeah, I'm a horse person. I got the horse stuff, but I don't know that much about cat breeds, so I should probably learn that. And so choose your own adventure and dig in. And we include these pause and consider points throughout where you go through some content and then it's like, okay, now stop and think about this. And it applies it to, how does this apply in practice now? What do you do on the human side? And does that apply here? Why or why not? How would you look at a prescription and consider if it has xylitol? Are you concerned about some of these common med groups having xylitol? And why or why not? And things like that, where it's asking you to think and apply so you can really start to absorb and digest and go, okay, I know how to actually use this in my day-to-day practice, and I can go back and use it tomorrow.
So we've kind of said that we feel like this Essentials of Veterinary Pharmacy is really for anybody, any pharmacist or technician that is encountering animals in any way in their practice will benefit from this. But we have more stuff in the works, right? So tell us about what's coming after Essentials of Veterinary Pharmacy.
Well, there's so much we can go into, and obviously in a 6-hour CE for essentials, we can't teach all of it, but we're going to give everybody that takes that a good foundation. But well, hopefully we'll have people that think this is really cool and they want to learn more, and they're like, okay, now what do I do? And so we're going to offer 2 different options. Again, choose your own adventure that you can go to from there. So you get the foundation essentials course under your belt, have that knowledge, and then you can say, oh, I do compounding pharmacy. I want to learn more about the compounding side of things. And we'll have a certificate program where you can go into the compounding information in depth. What do we have to consider with formulations? What do we have to consider on the legal side that's specific to compounding? And go into a lot of that in detail. And then we'll have another option where it's a more clinical based one. So what types of disease states am I going to see? I'm seeing these prescriptions and I want to know why. Why do we not use sulfonylureas in cats, but we do use human insulin? So tell me more about diabetes and those common diseases that we're filling medications for. The Essentials teaches you the basics. They teach you how to safely check a prescription. They teach you how to find the resources. They teach you legal basics in the community setting, but we don't go into a lot of the diseases and, okay, this is how you would treat this, just because we only have so much time. So this clinical certificate side is the next option to really delve into those conditions. And okay, that's why I'm using that drug in a cat. And hey, we're using mirtazapine to stimulate appetite, not as an antidepressant, and some of those fun things.
Yeah, I talked to my veterinarian the other day, and she didn't even realize we use mirtazapine as an antidepressant in humans because it's so much used for appetite stimulation. So yeah, so we have some other things coming up as well. I know in June we're going to have an evening live panel discussion with the veterinarian on the Beyond the Classroom series with freeCE, where you're going to get more. We'll kind of catch up on what we've done in the Essentials of Veterinary Pharmacy and maybe talk a little bit more in depth about some of the communication dynamics between veterinarians and pharmacists. What else are you thinking about will be in the Beyond the Classroom?
That discussion with the veterinarian is going to be really insightful because we bring both perspectives. And that's one that I think we're often missing. The veterinarians have a very specific opinion and perspective on pharmacists, and pharmacists have a very specific opinion on veterinarians. And so being able to get the 2 professions together and say, well, this is what I see from my side and why I care is going to be really insightful. And I'm looking forward to that discussion and how we can go into working together collaboratively. Both professions have a lot to offer. We also have limitations. And so how can we work together to fully utilize the talents of both professions and do that so that we can better the care for our patients? Really, that's the end goal for both.
And these are patients that can't speak, right? So a little different than the average patient that we deal with.
Yes. They certainly have their opinions and we'll share them, but they're just not in the normal English language like we have come to
They
expect.
can't articulate, and they can't articulate pain and some of the, and as you mentioned, itching and some of these other things that we see.
Yeah.
So, and certainly toxicity issues. So, can the pharmacist or the pet parent, if a person approaches you in community pharmacy and asks you for a veterinary medication, can the pharmacist dispense that without the prescription of a veterinarian?
Not unless it's a veterinary over-the-counter medication. Frontline is an example of an over-the-counter flea and tick product. And that one, if they're using it as labeled, that can be sold without a prescription. But any other medication that's in veterinary world, they say for veterinary use only on them. But they're basically the legend drugs of veterinary world where you have to have a prescription and that has to come from a veterinarian. Human over-the-counter products that applies to. So things like insulin that we might sell some of them over the counter for humans. We can't take a veterinary prescription for Lantus and say, oh, well, actually, we can dispense this other insulin over the counter. That's not legal. So we have to be really careful that we contact the vet. We get official prescription approval over the phone to change anything and use medications that would be over the counter in people and animals.
Okay. And what if it, like your primary care doctors, you have a lot of those folks in your world as a community pharmacist. One of them actually writes a prescription for Max the Beagle. Can the pharmacist fill that?
Yes. If they write the prescription for the dog, the pharmacist can fill that. Veterinarians do sometimes use human over-the-counter products in animals. I tell them they need to condition their clients that these need to be treated like prescriptions because they don't want their client to just assume, okay, I can go get this over the counter next time. So I say write a prescription, even if it's for something like Benadryl, take it to the pharmacy, and the pharmacist can fill that for them because in an animal, it is a prescription product, even though we think of it as an OTC in people.
Can a human physician write a prescription for an animal?
No, a human physician cannot. Human physicians are universal prescribers for anything humans. They can prescribe outside of specialties in human. Veterinarians can prescribe anything for animals, but they can't cross those species boundaries.
So as pharmacists, we really are unique in the healthcare world as being the only specialty, the only profession that is charged with taking care of all species, correct?
Yes.
Okay, so we talk a little bit about insurance and the fact that pharmacists deal with insurance, but that's really not a big deal. This is really a cash pay opportunity for pharmacists to be able to interact with pet parents, correct?
Yes, definitely. And it's actually a really great business opportunity for an independent pharmacy that has control over their pricing of medications to go through and create a veterinary medication pricing method because clients are going to price shop. They're going to say, okay, where can I get this? Because when you're paying for something out of pocket every single month, the full price of it, that cash price becomes really important. And oftentimes the discount cards that we commonly reach for in human pharmacy don't work with veterinary prescriptions because they require an NPI number and veterinarians don't have NPI numbers. So our clients get frustrated by that. So there's a lot of opportunity there. I don't think that's a gap that's really been addressed in the pharmacy side.
Also talking about setting up new practice models and revenue stream for independent pharmacists or business owners. You referenced a little bit about compounding for pets. If you're already compounding, tell me some other ways that this could increase revenue for the pharmacist.
By being able to market the specialty that you understand the veterinary side of things, veterinarians are often looking for affordable medications for their clients, and they want to make sure that the prescriptions that they send are getting filled correctly and safely. We're turning out a generation of veterinarians that have gotten used to having a pharmacist in their teaching hospitals at the vet schools. Almost all of the vet schools have at least one pharmacist now. And they're used to relying on that knowledge base, but that's not a knowledge base that's readily available currently in community practice. So by being able to have your staff trained and have a pharmacy that the veterinarians in that area can rely on to, I'm going to call this pharmacy and this pharmacist is going to know what I'm talking about. And they're going to be able to help me and discuss potential options and collaborate and discuss drug availability and help with determining pricing for my clients. And having that can really be a great resource, and you can really become a source of help for that veterinarian where they come to rely on pharmacies. A lot of veterinarians, they stock some medications, but things that they don't prescribe enough to go through their inventory before it expires, they're not going to stock. And so they're going to rely on sending prescriptions to outside pharmacies and finding pharmacies that have those medications in stock that they can prescribe.
And you even talk about in the module in advance of getting these prescriptions in your hand, spending time making relationships with your local veterinarians and letting them know that your staff has expertise in this area.
It is so much easier to call and talk to a colleague that you've developed a relationship with than it is to cold call a doctor because you have a question on their prescription. Veterinarians tend to be pretty nice. They would much rather you call than just guess. And so they usually don't mind. But if you've built that relationship ahead of time and said, hey, we're really trying to build our knowledge in this area, and my staff, we've done these trainings and we really want to work with you. I'd love to meet and discuss ways we can help you and be an extension of your practice. That's really important.
That's a great business opportunity.
Mhm.
And thinking about career retraining and retrenching, we know there's a lot of burnout right now dealing with PBMs and insurance and COVID vaccines and all the things that pharmacists have been doing the last couple of years. So tell me a little bit about the career path for pharmacists and for technicians right now, if they have a little bit of this experience under their belt.
As we start getting experience under our belts, we can really expand what pharmacists can do, and it can sometimes be into a new career path. Pharmacy technicians have a lot of knowledge on managing drug inventory that veterinarians just don't have. But veterinary clinics often have their own dispensary type models where they're trying to manage drug inventory, and they're starting to realize that it can be really beneficial to have a pharmacy technician with some veterinary knowledge come in and do their inventory management instead of delegating that to a vet tech. And so that can be really beneficial. There's a lot of opportunity there. You just have to have enough knowledge to speak the lingo and be able to speak, because it's a little bit of a different language. Vet world versus pharmacy world are not quite congruent. It's like United Kingdom versus United States English. They're just slightly different dialects. And pharmacists have the same types of opportunities where we have a lot of knowledge on regulations, compounding, controlled substance management. Those are really critical in veterinary medicine as well. And veterinarians, again, aren't getting a lot of training on that. And so there's opportunities to help and consult and do that. We just have to have the baseline knowledge to make it feasible.
So the Essentials of Veterinary Pharmacy is a really conservative, low budget way to get your foot in the door with this knowledge and be able to do it fairly quickly within 6 hours.
Yeah, it's a great foot in the door. It's a great, do I even like this content? Because there's so many areas of pharmacy, we're not all going to like everything. So it's a great way to get your baseline knowledge, make yourself more effective in a community pharmacy setting or a compounding pharmacy setting, and say, okay, I do like this. I want to learn more. And then set yourself up for opportunities to pursue more knowledge.
I've seen a lot more positions posted in the last year for a veterinary pharmacist or a pharmacist with veterinary expertise, both at the independent level where they've really taken this on as a specialty, as well as chains.
Yeah, it's becoming a big deal. There's a lot of profit from medications, and a lot of that is still centered within the veterinary profession, in that historically veterinarians were their own pharmacists, essentially. They didn't have to send prescriptions out, and they did a lot of their own medication filling. And the newer graduates aren't so interested in that. They didn't have to do much of that in school, and they have a lot of other things they've learned how to do. So they want to offload some of that to the medication experts, the pharmacists. We just have to have the knowledge to be ready to catch that.